Hi, I'm your host, Dr. Jayne Morgan. In this episode of Healthy Her, we're weighing in on weight loss trends. In a society where obesity rates are soaring, we're witnessing a surge in weight loss injections and pills like Ozempic and others. But are these treatments truly effective, or do they pose unseen risks? Today, we dissect the effectiveness and ethical considerations surrounding these trends. We'll also explore the profound impact of societal beauty standards on body image and delve into the importance of fostering a healthy mental and physical relationship with food and exercise. Joining me right now in this thought-provoking discussion are a few experts on this subject. We have Dr. Bindia Gandhi, who is the medical director at Revive Atlanta MD, a comprehensive clinic focused on total body healing, including decreasing inflammation, improving hormonal imbalance, helping people with weight loss resistance, gut health, and more. And Dr. Nicholas Jones, who is not just your average plastic surgeon. He's a visionary in the field of aesthetic and reconstructive surgery. With dual board certifications from the American Board of Plastic Surgery and the American Board of Surgery, his professional ethos centers on providing top-notch aesthetic and functional outcomes, all while prioritizing safety and comfort. And Taylor Warren, a licensed professional counselor and the owner of the Grove Counseling and Consulting, with her expertise in supporting teen girls and women through challenges like anxiety and perfectionism, self-esteem, and eating disorders, offering invaluable insights into the psychological aspects of weight loss. So let's get started. Weight loss, injections. Is it about health? Or are we witnessing a shortcut culture in weight management just taking over? What do you think, Dr. Bindia?
So, I have lots of takes on this. I see a lot of diabetic patients in the clinic. I've seen a lot of patients that are morbidly obese in the clinic. I will say there is a place and time for some of these injectables. Not all the time, but there is a time and place where we see some profound improvements, especially clinically. I see great numbers in A1C. I see cardiac reactive protein, CRP numbers come down. So it's more than a little bit of losing weight and aesthetic.
Right.
It's about also decreasing inflammation. And studies are now showing that from a cardiovascular risk factor, there seems benefit there as well.
That's absolutely true, and especially with Wegovy. As a cardiologist, we're keeping an eye on that, but it's really looking interesting with regard to heart failure outcomes and cardiovascular outcomes. Dr. Jones, you have a different approach. Do you have a different take on it, or
No.
what do you think about
No,
this?
I think it's a great drug, and I think it's interesting because I offer the drug to my patients as well, and oftentimes
So you offer it sort of
Yes.
in conjunction with plastic surgery?
Yeah,
or-
because a lot of people who are seeking plastic surgery, they may not actually be a candidate, and some of the time, one of those reasons is obesity or they're overweight. And so a lot of times I can get them on a medication and get their weight down, and oftentimes they just decide they don't even want surgery. But for those who want to proceed, they can get a much better result. And then I also feel like I'm doing them a service because a lot of times they take these antihypertensives, they have arthritis, and oftentimes they take the medication, lose the weight, and some of them don't even need their antihypertensives anymore.
So we might talk about that. You're actually an internist, it sounds like. I saw that you were boarded by plastic surgery, but you're actually practicing internal medicine.
Yeah, you know what? I am. Because a lot of times you'd be surprised, a lot of people don't have a primary care doctor. And so I feel like if I'm helping them lose weight and they can live a healthier life, then why not?
All right, so that might be your secret sauce. And what about you?
Yeah, so with my work with teen girls and women in the psychological side of things, my take will be a little different in that our society is obsessed with thinness, and what we're seeing is a lack of trust in our bodies, unhealthy relationship with food and our bodies. And I think with Ozempic and all the GLP-1 medications, it's promoting a message that our bodies can't be trusted, that they need to be controlled or manipulated in order to be okay or to be good enough. And that's speaking to from a standpoint that I know there are many pockets of people who may be interested in these drugs, and so there is absolutely a time and place when it comes to diabetes or addiction, even with the research on that. But in general, the pursuit of thinness and the concerns that come with that, with body image and relationship with body, is highly concerning.
Yeah, and you're dealing with teen girls, so we're talking about a
Absolutely.
developing mind, developing body, all the societal pressures, and then social media, and
Yes.
not wanting to miss out or being left out and wanting to be included. And so how much of that is emotional, psychological, peer pressure that you have to kind of sift through
Yes,
to
so
get
much
to
of
the
it.
actual meat of the matter? And
So much of it is that, and that we have to work on what kind of content are you consuming? Who do you follow on social media? Do the people you follow make you feel good and
Right.
confident, or are you noticing that you're feeling less than and overwhelmed or anxious?
That's right. And anxiety is a big one. Why do you think people hide the fact that they use weight loss pills or injections like Ozempic, Wegovy? Why are we hiding that? Let me start with you, Dr. Jones.
Yeah, I think I have mixed feelings about it, because I have patients who are completely fine. They want everyone to know. They want their friends to know. But I think some people are just ashamed because they feel like they're cheating, because they're taking a medication, and sometimes they feel like they're taking a shortcut.
Do they
And
feel
that-
like they're out of control? That
I think it's peer pressure, like peer
Okay.
pressure. Like, for example, I have two friends, they're both physicians. One openly said, "Hey man, I've been on this Ozempic, man, I lost 10 pounds, I look like I did 20 years ago." Then I have another friend who's also a physician. He doesn't want anyone to know that he's on the medication.
Right.
And so I think it just, your mindset, and also just how you just feel about like weight loss in general, because some people feel like they're cheating, and then some people just feel like it's an aid. Like, if it's getting me the result that I want, who cares how I've done it?
Right. I mean, Dr. Bendia, what do you think about, are people concerned about willpower, or looking as if something's controlling them, or looking as if they're out of control? They want, again, in society with
Yeah.
social media, do you want to look as if you've got it all together, or
Yes.
is there just kind of an openness? Let's let it all hang out. Here's what I do, and
Yeah, so I'll be honest, like, I think for some people it's really hard to have discipline and lose weight naturally. I can talk to you all day about diet, exercise, what to eat, but for some people, they are what we call leptin resistant. So they have a little hormone that makes it harder for them to lose weight. And I think for people like them, it can be either embarrassing to admit that, I'm taking this medication, or the opposite end is like they feel confident. Wow, psychologically it's helping me. My appetite is different. I'm getting full faster. So I mean, there's a lot of pros and cons to this medication.
Okay.
But I will say there unfortunately is a stigma, and I think that stigma comes from social media, from celebrities, and I think that's where people are like, hush, hush, I don't want people to know I'm taking this medicine.
Right.
But I think for many people it really does help.
yeah. And when we look at the culture of unprocessed foods, super ultra unprocessed foods, especially here in America, where our food cultures maybe are not that rich. In many westernized countries like America and England and Australia, and so we don't necessarily have meals and family time and that type of thing, and we have all kinds of foods with long lists of ingredients that nobody can pronounce. You can never reproduce them in your kitchen. There are all kinds of weird colors that don't come in nature, and they really have no nutritional value, and they're actually driving our desire to eat more of these kind of empty calories. I imagine, I don't know if it's true, you can tell me, I imagine teenagers, because a lot of this brand and packaging is focused on teenagers and children.
Oh,
so I
yes.
imagine I'm imagining that could be part of what you have to manage as well.
Yes, and that this is very nuanced, right? And that, to answer the question that we were talking about prior to this too, It's become a moral issue in our society that
Interesting.
people who are disciplined, who work hard, who care about their bodies are healthy and thin. That's the message that diet culture has sold
That
to
is
us.
the message.
Yes,
Yes.
absolutely. And so it's become a moral issue in that it's bad to be overweight, or and somehow you're less than if you are in a larger body. But I operate from a health at every size lens in that, in our society, health has been so attached to weight and body size, and in some cases that is true. But in many ways, we know there are people in very thin bodies who are highly unhealthy. When you look at the eating disorder population that I work with. And there are also people who are in larger bodies who, when you look at blood work and you look at their fitness activity, they are taking care of their bodies. But genetically, people are going to show up in the world differently. And so unfortunately, with our thin body ideal, teen girls, women, and everyone is really subject to that message that to be good enough, to be seen as moral, you have a thin body, or you're on a pursuit for a thin body for your whole life.
Yeah, I mean, I think those are really good points. And what you're saying really is, do we find that patients are primarily concerned about health, Dr. Jones, or physical appearance? Since really you do the most to aggressively change the physical appearance. What are your patients? Do you think is really driving them?
My patients, I think what's driving them is their physical appearance. I mean, the health, nobody's having plastic surgery because it's a healthier choice. I think people want to look a certain way and they come to see plastic surgery.
I looked at your Instagram, by the way.
Okay, yeah.
You're removing a lot of fat.
Yeah.
That looks like it could be pretty healthy.
Yeah.
To do that.
I mean, so here in Georgia, there's a maximum amount of fat you can remove, 5 liters. So 5 liters, that's about 10 to 12 pounds. So patients don't come, I make it very clear that what I do is not a weight loss option.
Okay.
But I think for me, most of the patients, when they come to me, they come because they want a more natural look. I'm not trying to make their butt
natural.
I'm not trying to make make this big bubble butt and you have these little thin toothpick legs, because it's not going to really match your body habits. And so even for larger patients, if I feel like I can get you a reasonable result without compromising their safety, they may be a candidate for surgery. And then I don't completely agree with some of the things you said. Like, I feel like my patient population, they don't want to be thin. I feel like they're attuned to, their bodies, and they just want to look better. And for some people, looking better may just be able to fit
contour.
Contouring, exactly.
And shaping,
yeah,
going for fab.
Yeah. So I think it really depends on the patient, but
between the two of you, I would imagine, and you can correct me, you're dealing with more of a vulnerable population in young teenage girls.
Yeah.
Absolutely.
And so that might be a little bit of a different approach
and
a psychological than perhaps.
And then culturally too.
Right.
That's what I was about to say. Yes,
Yeah.
there's a cultural difference. Different populations are going to pursue differences in the beauty standard.
Right.
But in general, in our world, thinness is pursued. And so that might look a little different in that it's thin with, larger body parts, right, in different areas. But that's been the theme for years and years and years, is that thin is the gold standard.
Yeah, no, absolutely. Dr. Jones, let me ask you something. As a plastic surgeon, and clearly this is fascinating for me, but as a plastic surgeon, you have patients coming in really looking sort of for rapid results, this quick fix culture. How do you really address that?
So I just try to make sure we're on the same page, and make sure that they have realistic expectations. Like with social media, a lot of times patients come in and they want to be this thin person with this huge butt, but they may start at over 200 pounds.
Right.
So that may not be a realistic expectation.
And they think
for
you
them.
can just take something from one place and just put it there. I just need you to move some things around.
They see that on TV.
Right.
And they see these images that have been altered, and they think that
They're just going to mold.
Right. And so that's just not realistic. And if we can't come to an agreement, then they're not the patient for me.
I like that approach, and I'm going to ask you, Dr. Bindia. I recently was listening to a patient who was giving sort of a heartbreaking story about how they really were treated better after they lost weight. And they didn't realize that they had not been treated well until they lost weight, and then they felt like people were nicer to them and a little kinder and a little more accepting, and even in the store people would come up and offer to help them. Do you find that as a part of your practice, that you're dealing with patients who are talking about those differences after they actually have had their successful weight loss?
I'll be honest with you, I have never heard that. So this is the first time I'm hearing that, and that makes me kind of sad to hear that.
Yeah.
And that, there's such a big difference between your weight. What I will say, Dr. Morgan, I'm actually working with patients on a very different scale. So I always start with diet. I'm looking at the basics. Let's start with your diet. How can we lose weight naturally if possible? If we decide that you're unable to lose weight naturally, or in my case, I find out that you have something called leptin resistance, that's when maybe we'll use agents like GLP-1 medications, But I'm going from an angle of how can we lose weight with diet, nutrition, supplements, lifestyle changes, because changing these things from the inside out probably gives you better lifestyle changes. What I have seen is two extremes of this. I've seen patients who've been on Ozempic, or the various brands of this, and end up losing maybe 50, 60 pounds, but then gain it right back because they never learn how to eat well. They never learn their lifestyle skills of exercise, maintaining their muscle mass, all of the above. And then I see the other group of patients who actually, do all of this and then maintain the weight loss off of the medication. So everybody's different. Every single mindset is different as well. And one of the things that I like to work with is mindset in all of our patients, because it is about the whole body, and it's about getting to the root cause and getting them long-lasting results.
So it's sort of this root cause analysis.
Exactly.
And so that's part of your practice. That's what integrative medicine is, which is what you practice. And you have your patients there for, how long? Is it a session? Is it a year?
I work with my patients for years, honestly.
Okay.
It's essentially like a primary care practice that we do integrative medicine, and we do functional medicine. But I'm following these patients for years, so I see the ups and downs. I see when they've regained the weight back, or they're struggling based on life, and I see how life changes, and when stressors happen, what happens to their body, inflammation. I'm looking at their lab numbers, like I'm scrutinizing it, so I see patterns, and I start to pick up on things that I'm able to kind of help hone in on, okay, what do we really need to work on? Is it really stress?
Right.
Half the time, that's probably what it is.
Yeah, it's a good thing to think about. Taylor, speaking of stress, you're working with girls or teenagers who often have some self-esteem issues as well. And how does that impact their outcomes and maybe even your approach to them?
Yeah, so the implicit bias, that you're describing in your question to Dr. Bindia is, part of that stigma that has come up that does impact self-esteem and people's relationships with themselves. But because of the toxic messaging around thin meaning good enough, there's an implicit bias around that, in that people don't realize that they're treating people in larger bodies worse. So it's not this explicit bias where they're using slurs or truly being mean to that person, but people in thinner bodies are treated as if they are smarter or worth more all of these different things. And so
That's what I heard this patient discussing.
yes, yes, and that's incredibly common.
Yeah.
For
She
people.
was saying she liked being thin because people liked her better.
Yes,
People
and,
liked her.
and I want to say too, I
Isn't that
have
heartbreaking?
so much empathy for that, because to exist in this world in a larger body where you are subject to mistreatment or being excluded, so many different
Judgments being made about you.
Yes,
Right.
judgments, and then even, on the other scale too of obesity and not being able to fit in your airplane seat or having to buy 2 tickets, right, because of how much space you're taking up.
Or not buying 2 tickets, and then you're sitting there and you realize that you're crowding other, and you're apologizing, and you know.
Absolutely.
So the whole
this,
thing.
of course, is going to have an impact on self-esteem, because if you have a larger body than what you hope to have, or your body is larger than what you believe would be good enough, then people are going to go internal with that and say, well, what is wrong with me?
Right.
I'm not okay.
Right. You know, Dr. Jones, you hit on something before in your practice of internal medicine. Now we know you're really an internist, not a
I'm an
plastic surgeon.
internist. Yeah,
But you hit on something before. Are there patients that you turn away? And
Absolutely.
if so, who are those patients? What's the
Absolutely.
profile of the patient that you would turn away?
Pa-
And maybe refer to Dr. Bindia for
yeah. So
integrative, holistic.
So patients who have unrealistic expectations, they're getting surgery for someone else, like a spouse. Like let's say it's their husband, their
So
wife.
that's
they want them
common?
to. Yeah,
That's
that's pretty common. And then also obviously patients who have contraindications to surgery, and then those patients who have like mental illnesses, because they're not really ready to have surgery. But the one thing that she mentioned I wanted to comment on is it's also doctors. Like a lot of patients, they go into a doctor's office. If they're overweight, they're obese, I feel like sometimes the doctor treats them differently. Oftentimes, you can't, every patient is not, oh, you need to change what you're eating and go
Right.
exercise,
Right.
because that's not going to work for everyone.
I preach that
Like,
all
it-
the time, especially women in midlife. There are all kinds of other
Right.
things happening. But anyway, I'll let you continue.
No, I'm
I
just,
won't just jump in here
no,
now.
what I'm saying is like
I'm starting to get up.
we treat obesity like there's one fix, but
Right.
it's a multifactorial
spectrum.
problem. Yeah, and so there's no one quick solution for everyone.
But to be clear, you're okay with the GLP-1s.
Yeah, absolutely, absolutely.
And that's part of actually your practice. You've integrated
Absolutely,
that into your practice.
I love it. I think it's a game changer.
Yeah.
If it's helping them get off of their antihypertensives, their diabetes is controlled, they can walk, they can live a healthier life, why not? I
Yeah.
mean, it's either that or take the metoprolol.
Yeah. And listen, I'm starting to come around. One thing I was concerned about is the price that is available only to we sort of have the haves and the have-nots, and then once people are off it, the weight comes back, and that's not healthy. You're yo-yoing, and then there's the mental part of it. But now that I'm seeing the publications on cardiovascular outcomes, you're starting to kind of bring. It's like, oh, okay, now you're talking my language. But I appreciate that. Let me ask you something, Dr. Bindia. How would people find you or follow you if they want to make an appointment with you, or if they want to know more about you or what you're doing or your patients? How would they do that?
Well, Instagram is such a great panel. You can follow me at Dr. Bindia MD or drbindiamd.com.
And spell that.
DRBINDIYAMD. And our practice is Revive Atlanta MD in Atlanta.
I love that. I love that. And Dr. Jones. And I've been on your Instagram. It's awesome. So everybody, please follow her. And I love holistic and integrative medicine. Actually, yes.
So you can follow me on all social media platforms. It's Dr. Nip and Tuck. My website is also drnipandtuck.com, and my practice is in West Paces, and the number is 404-777-TUCK. T-U-C-K.
404-777-TUCK.
Correct.
I like that. All right. Taylor.
Yes, so my practice, The Grove Counseling and Consulting, the website is thegrove-counseling.com, and you can also find me on Instagram at thegrove.counseling.
I love that. And I'm Dr. Jayne Morgan, always DrJaynemorgan, Dr. Jayne Morgan, on all the social media channels. You can find me everywhere. A special thanks to our guests and viewers for tuning into Healthy Her. As we discuss the various approaches to weight loss, we encourage you to choose the method that best suits you, prioritizing safety and health above everything else. Remember to respect your body and nurture your self-esteem. Join us next time for more enlightening conversations. In the meantime, stay safe, stay healthy, cherish your unique path and wellness. Until next time, see ya.